started having issues a couple of years prior to moving to Cincinnati, and the doctors there were a little slow about getting things rolling, and I'd moved out here, and so of course they referred me to Dr. Tempel here. First he was going over the x-rays and showing me all the stuff I had going on. He suggested, that I do this surgery, and I asked lots of questions. He was telling me about how the procedure would go, and at that point in time we hadn't discussed the pulse machine yet.
When you can combine multiple modalities into one machine, right, with extremely high precision through a smaller footprint with the smaller arrays, that really improves your workflow, improves efficiency, leads to less time under anesthesia, less blood loss, especially in bigger cases, more accurate radiographic results for patients. It's more cost effective for the hospital. Everyone wins at that point, right?
It's really that integration, as you talked about, into everything else in the OR, which makes so much sense to have everything in one spot.
It's kind of a one-stop shop, and especially in terms of OR workflow, it takes up a lot less space.
With Pulse being this all-encompassing piece of equipment, it reduces the need for devices being brought in and out of the OR.
Every case you may only use one or two components. Some cases you'll use all the components, but
right.
You have them all there at your availability, whenever you need them.
It makes it more enjoyable because my surgeons seem happier. We're not waiting for another person to wheel another piece of equipment in. We're not waiting for all these other things. It's all right there.
Being a vascular surgeon, I'm exposed to radiation on a daily basis. A lot of times I get monthly letters stating that my radiation has been exceeded. And to me that's scary, and I don't like seeing that. So having this technology that I use on a daily basis to decrease the radiation I'm exposed to increase the safety for me, for my family, and for the patient is huge.
It's integrated with the staff very easily. It's less things that they have to worry about. I'm all about being efficient.
If I'm a hospital system, if I'm a surgery center even, or a surgeon thinking about what technology I want to use in my operating room, I want something that has longevity. I want something that has possibilities and can evolve with times, because we are seeing really an extremely rapid evolution in spine surgery. It's different now than it was 2 years ago, which is different than it was 5 years ago and 10 years ago. Patients are becoming smarter than ever, right?
Every time I was talking to people before surgery, well, if you go now and have this done, you're gonna have to go back again and have something else done. The most part, people that was hesitant on the back surgery, they just weren't educated at all.
I've had 4, 5, 6 patients maybe that have come in and asked me if the Pulse platform is going to be part of their care.
Yeah.
And it's nice to know that patients are requesting it, because they are getting smarter about how we're taking care of them, right?
Yeah.
I was more comfortable knowing about the technology and how promising it was. But I was up moving around and going to the bathroom and doing all that fun stuff within a couple hours, and I was up walking 1.5 miles before the end of the next week. So everything went great.
What Pulse does, it puts everyone else on notice that this is the way it's got to be done, right? We are beyond the time where you could find one cool technology and bring that into the operating room, and it's really, moving forward to improve efficiency and enhance, what we're doing surgically. It's really got to be all in one platform.